for me because I could fall asleep. I would have no problem at all falling asleep. Maybe it was a long time ago, so maybe it took a little bit of getting used to, but I really don't remember it being difficult. I think maybe sometimes putting it in it took a little getting used to, but I have that down now. But I would sleep so much better. And 6 years, that was 6 years ago. I haven't slept one night without these things. So I think that tells you how dependent I am on them.
Like I can use the hashtag role model. You're really a role model for a lot of my patients. I'm going to ask you, maybe if you can remember the difficulties you had during the time you have to get used to oral appliance.
I think it was just I would have a little bit of trouble like putting it in, but I was like doing something wrong because it's so easy to do now. So I don't know. Somehow I learned how to do it and I got very used to it quickly. And I think, you have to test like different settings. And I guess at one point we might've gone too far. So we had to like scale it back. And I had a little jaw pain when it had gone too far. So, it takes a little bit of work, just fine tuning to get it just right.
No, like any treatment, it's always a learning curve, but you did it so well. And I know you had two appliances. One was Somnomet appliance, and now you have a Prosomnus appliance. Can you recall any difference with the management of those two appliances or your comfort with those two appliances or anything you can mention?
Well, I think they're both pretty much equally comfortable. The second one, I guess, is the Prosomnus, if I'm pronouncing that correctly. That one,
Prosomnus. Mm-hmm.
And I find that one a little bit easier to clean. You can just see it better. The other one, this didn't seem to clean as well. And I think keeping it clean is important. And I know with the second one, I clean it with antibacterial soap. The first one I was using toothpaste. And I think the soap works better too. So, that I like that a little better.
Very nice. Can you please tell us about your sleep in general? I want to kind of bring your memories back to the time when you did not have any appliance, in time that you did not try the CPAP machine. So if you can compare between the time when you did not have any treatment, then when you try the CPAP, and then when you have an appliance, if you can compare your sleep in general.
Yeah, it was kind of strange because I went to the doctor, not because I was having sleep trouble so much, but because I was snoring. So I didn't really know anything about snoring, but my wife complained about it. So I was at the doctor, I think, for something else. I was just getting a regular checkup and told my doctor about that. And he sent me to the ENT, and that's where this got started. And I don't think I didn't realize then how bad my sleep was, because I would wake up with a certain like feeling, like foggy head, kind of like maybe slight headache every day. And I was just so used to it that it never occurred to me that I was having any kind of like sleep issue. But then when I did the test, sure enough, it showed that I was waking up so many times during the night. So I was kind of surprised by that, but it, like I said, it had been, a long time. So it just felt normal to me. So then I got this and, tried sleeping with a device, and it's just a different experience. I do not wake up with that like foggy feeling, I really wake up feeling rested and clear because I'm tired at night and listening to the radio. I don't put it in usually till just before I go to sleep. And if I do that, one or two things will happen. Either my wife will very quick thing in, or the other thing that'll happen is I might sleep if she doesn't do that, I'll sleep for a little while. And then I'll wake up and I can feel like something just doesn't feel right. So like, I've been sleeping a while, but I don't feel like rested. So I'll put it in and then, sleep the rest of the night with it. So it definitely makes a big difference. And, I haven't missed a night. I sleep with it every night. When I travel, I take the old one because I don't want to ever lose it, the new one. So I have that one, I worry about losing it because it's kind of like dependent on it. And it takes a while to get a new one. So I wouldn't want to lose it. So I'm trying to be careful
Of
when
course.
I travel. That's my big fear, is like going on a trip and forgetting to pack it or something.
No, of course. I have a question. You explained it so well. So when you use the CPAP machine, you have to use some Ambien. Do you have to use Ambien now?
No, I sleep very well now. Now, the only thing I'll say is, it's crazy times in the world. So sometimes I'll wake
Of
up
course.
thinking
No,
about the pandemic or something. And
no,
but otherwise, I think I sleep quite well.
no, a lot to think about. I absolutely agree.
Yeah.
And that's why in this very turbulent time, I want to make sure patients or my, people who need care, they have a good sleep. I think that's a
Yeah.
critical thing to be able to absorb or survive or, live, enjoy
Yeah.
through this difficult time. Also, I know a lot of my patients, and doctors, referring doctors, very concerned about pain in the jaw joint in the long run, as well as about the bite changes. I'm wondering if you notice during, not in the beginning, I understand in the beginning, you had some pain when you had adjustment and when we play with the settings, but in a process of now, in the present time, when you're already used to the appliance, do you feel any discomfort in the jaw joint?
No, I have no discomfort in the jaw joint. Just at the beginning when we were trying it out and trying to get the setting right. And also, I haven't noticed, I don't think there's been any change in my bite at all.
No, this is so nice. Thank you very much, Mr. Allan.